PETALING JAYA. With Malaysia's 2-week lockdown due to expire on Monday, its government is said to be eyeing an extension as the number of daily coronavirus infections has yet to dip below 4,000 and the deaths remain high. The National Security Council, which is scheduled to meet on Friday, is expected to discuss the lockdown extension, though cabinet ministers kept mum about the meeting agenda. Datuk Seri Ismail is also the minister in charge of the announcement of COVID-19 measures and the movement control order. A source told the Star newspaper that when the lockdown was first decided, the ministers had thought that 2 weeks was too short to contain the pandemic and the issue of lockdown extension would be discussed in Friday's meeting. NSC meetings are confidential and the only people who can speak on its decisions are the Prime Minister Muhyiddin Yassin, Mr. Ismail Sabri and Health Director General Noor Hisham Abdullah. Another source also pointed out that the government knew from the start that 2 weeks of any kind of lockdown would not be enough, and for that reason, the letters of approval issued by the government for businesses to operate during the lockdown do not carry an expiry date. On Wednesday, the Health Ministry stated that the country's RT, an indicator of COVID-19 transmission rate, has reduced to below 1.0 to 0.96. On May 28, the Prime Minister announced that the country will go into a lockdown for 14 days from June 1, with only the essential economic and service sectors being allowed to operate. At that time, the healthcare system was deemed to be on the brink of collapse as the number of daily cases had breached the 8,000 mark and new variants had emerged. Mr. Muhyiddin then said should this first phase of lockdown succeed in reducing the number of daily cases, the government would move on to the second phase of 4 weeks that allows some economic sectors to open provided no large gatherings are involved and physical distancing is practiced. Malaysia on Thursday recorded 5,671 COVID-19 cases, bringing the cumulative total to 639,562. There are 3,684 deaths so far with 73 new fatalities. Meanwhile, the Health Ministry has detected 60 festival clusters over the past 3 weeks, which were attributed to the Hari Raya Aidilfitri and Hari Gawai holidays. Mr. Noor Hisham said from May 13 to June 10, there have been 58 clusters linked to Hari Raya Aidilfitri, while the ministry recorded 2 clusters linked to the Hari Gawai festival. Dr. Noor Hisham said the states that recorded the highest festival clusters were Sabah with 11 clusters, followed by Sarawak and Kedah. Kelantan and Perak recorded 6 clusters each, while Johor and Pahang each recorded 5 clusters. Malacca recorded 3 clusters, while Penang, Selangor, Labuan recorded 2 clusters each. Terengganu, Negri Sembilan and Kuala Lumpur recorded 1 cluster each.